Jake and Dana on the Cat.
So Total Wellness Tuesday, another opportunity for us to get well and healthy and do some mental improvement as long as a physical check. That's a good reality check every now and then to have, right?
It is.
Dr. Beth Whiteside from ImageCare Medical Imaging of Community Care Physicians speaking on the importance of early detection and screening mammography. Hi, Dr. Beth Whiteside. How are you?
Hello, I'm great. Thank you so much for inviting me.
Yeah, we're glad that you're here, definitely. Welcome to the radio station. You haven't been to the studio before. Have you done radio interviews like this before?
This is my first radio
It's
interview.
a little weird, right? You walk into a room, you don't know what people look like, you have no idea what to expect.
She listens to us, so she said she had to close her eyes and listen to my voice.
Oh, you listen to the show?
Yeah.
Yep. If I close my eyes, it feels just like I'm in my car.
Oh, cool. Well, thank you from the bottom of our hearts, and I mean that.
Yeah.
Dana and I say it far too often, but it's the truth, and it's not to be taken lightly. We have no idea that what we're doing is working. So thank you for listening to the show.
It
means a lot. So let's talk about early detection and medical and screening mammography. There's a few things. You brought some stuff in too, which we're going to.
I brought some props with me this morning because I think it's important just to start at the beginning. How do we detect breast cancer? There's really two main ways. One is with a woman or the physician feeling the breast and feeling a lump. And the other main way, which is how we detect most of the breast cancers, is through mammography.
Okay.
So I did bring a little breast model.
You brought a breast model?
She brought a boob.
Breast model.
Do I have to be mature about
and we
this?
use this for teaching. There are lumps in that model. It's kind of a little bit of a jelly kind of a feeling thing.
And you use your two fingers, right? Is that I think I was taught
Can
that.
I use 4 or 5?
So the bottom line is this model has
I felt them
several
before.
masses. Some of them.
All right, I feel one.
Right.
Yep.
So
and it's
you're doing a great job.
Stop hogging the boob. Give me
the boob.
I just, for medical
You
purposes,
are a boob.
obviously, I want to.
You can have a boob.
All right, so shape this way.
Yeah,
And two fingers. I'm like, hey, prom date. Okay, hang on. All right, sorry.
He's groping.
Right.
It does not happen.
What am I
that
looking
way.
for here?
You feel really go down and feel. You tell him.
Yeah. So I mean, there's about 4 masses in there that you should be able to feel.
Okay.
Once you get good breast exam.
Oh, wow. You had to push kind of hard, huh?
And the exciting part is that there's also masses in there that you cannot feel. As long as I could leave that here with you all day, and you're not going to feel some of them.
Yeah.
The reason is they're too small to be palpated, and you would see them with mammogram.
Okay.
So if you feel one, I mean that's right away. Make sure you get in.
If you feel something that's changed in your breast, sometimes a woman will see a change or notice something is different, and then you need to go see your doctor, and they will, in all likelihood, send you for some imaging. But
are there times when you like false alarms? You think that you feel something and you go and they say it's not a big deal? I mean, I've heard about that, right?
Absolutely. A lot of the time it turns out to be just lumpy normal breast tissue or maybe a benign fluid-filled cyst. But the truth is you just don't know by how it feels, so you have to come in and get it checked.
Okay.
Now,
it's always safe.
When is there a right time to check for a self-exam? So I know we talk about going in the shower, being in the shower and going, is it like once a month, a certain time a month, and that, I think that's where a lot of people don't know because you do have changes in your body throughout the month.
Right. So probably a week after your cycle has started is a good time. But whatever you do, just if you're doing it routinely, you'll notice a difference if something changes. And that's important because everybody doesn't see their doctor all the time. Yeah. So you have to be aware of your own body. And if something changes, bring it to someone's attention.
At what age should we start? That's the biggest. What age should you start, at least with the self-exams?
So in terms of self-exams, I mean, I think, you can start at any point. Again, it's becoming familiar with your breasts, okay? And the most important part is that we're trying to detect breast cancers before they're big enough to be felt. Yeah. So that's where it gets to mammography. And that's really important because it's a lifesaver. Most people who develop breast cancer don't have risk factors. They don't know, that they have a lump. And you need to come in and get a mammogram starting at the age of 40 every year. Okay.
And with that said, too, by the way, going in for the mammogram, that's early detection, that's pre-screening stuff. But then you go further to even discuss what new technology is available and, tomosynthesis. Am I pronouncing that correct?
Yes, absolutely.
Okay, so tomosynthesis and 3D mammo are also different things that are offered there over at, I guess what we have here, CCP, Community Care Physicians, right?
Absolutely. So at ImageCare in Latham, we have these great new mammography machines that we kind of call it 3D mammograms sometimes. And what that does is kind of a souped up mammogram, and it allows us to look through the breast in very thin slices. And what's the advantage of that? Well, with mammogram, we have a lot of issues with tissue overlap because we're taking a breast that it's like a ball shape, you know, and we're squishing it, and there's a lot of things that are overlapping when we do that. So to get rid of that tissue overlap, we have the 3D mammogram, allows us to look through some of that more
That's
carefully.
good. Wow.
Go layer for layer then, kind of.
Yeah.
Absolutely, kind of like a slicing through bread, that type of a thing. And the best thing about it is that there's a lot of great new studies that are coming out showing it helps us detect breast cancer earlier, much smaller.
Yeah.
And it decreases those false positives you're talking about, where someone has to come back to get something looked at that turns out to be nothing. So it's really a win-win because it helps us find more and it helps us not bother people who don't need to be bothered.
It saves time and energy and anxiety, I'm sure,
Absolutely.
too, because people think that there's something wrong with them right away. It's like the worst case scenario.
Absolutely.
I think you find a lot of women just, you know, they are afraid to go. And they actually also think it's a hassle. You know, it's I have to go and get that. You know, it really doesn't take a long time, does it?
It doesn't. It is very quick. You know, it's 15, 20 minutes, and it's a potentially life-saving thing.
Well, this is something that people should be taking very serious. And I know that it is taken serious for the most part. But even when you're not thinking about it, you know, if you see information like this pop up on your newsfeed, click it and read about it. And if you have more questions, always go over to Dr. Beth Whiteside from ImageCare Medical Imaging of Community Care Physicians and ask questions. As a matter of fact, this is a service that's available 5 days a week, 7 days a week.
Yeah, absolutely.
Yeah.
So, I mean, you know, the bottom line is, you know, come in. We know everybody's busy. We know it's hard to take time, but take time for yourself because, you know, it's really important. Your health is very important and you just don't know. And the whole idea is to get these things detected quickly, early, so that they could be treated really easily and you don't have to disrupt your life and everybody else's life. And, you know, don't be afraid. Just take charge of your life and your health and your happiness.
Powerful stuff.
Yeah.
You're absolutely right. Thank you, Dr. Beth Whiteside. We
Thank you
appreciate
so
you coming
much.
in for Total Wellness Tuesday.
Wake up with the Cat. Jake and Dana. Mornings 5:30 till 10 on the new 100.9 The Cat.